Am I audible? Okay, so very good day, good evening to everyone who have assembled here. It's very happy to see that so many of you are willing to spend your time very well in a Sunday evening. So we have been going through this series of NEET preparation, right? And I suppose you will positively be having your exams in December. So last class you had dealt some concepts in epidemiology, and this class of today it's going to be on healthcare delivery systems. It's going to be on healthcare delivery systems in India. So uh, why this topic, or how do you think it's going to be useful to, like, for a NEET aspirant is you technically speaking, you don't get much questions, but for us to understand what is happening, how the health is being delivered, and what is actually how the healthcare delivery systems or the different programs which is being done in India is being taken care. You need to understand the basis of how this care is being delivered, right? And one more important thing is, though there are certain questions like if you take since this is a public health topic, and Soban Peter is one book all of us will follow. In that book, this healthcare delivery systems, at the end you have got like the WHO themes, and as well as the important days, World Health Days and other days which we need to follow. So these are all the important aspects which, as a person, in which will, as a NEET aspirant or for people who are preparing for NEET, it's important for you. And apart from that, you need to understand, once you finished your MDS, or the people who want to go into government jobs, you need to understand where you need to go, right? What kind of, even though we have got n number of programs, who's operating it, and what level as a dentist I will be useful to that program, so whom I need to approach. So all these things comprises of your healthcare delivery. So this per se technically is a very important chapter for us as a health professional to understand, to make reference. Okay, so before I move into this topic, I would like to have just tell 2 points. One is that I don't like monologues. Personally speaking, I don't like monologues. I keep talking, I hear only my voice. I understand you cannot talk from your hand, but I request you all to be not just attentive, but be interactive. Okay, you can talk, you can ask any doubts, you want to learn something, you can do it. So when I heard this topic, I wanted to cover certain areas, though I'm not going in depth in detail over the entire chapter. I just want to touch few areas which I think will be the core aspect of this healthcare delivery. So that's what I'm going to discuss today. It's going to be just a 30 to 40 minutes class, not more than that. So if you have any doubts in that, you can ask me, you can stop me. Or if at all you want to learn something else more on this, please put it in the chat box. We can anyway discuss it after the proper class is done. Okay, so before I go in, I just want some few of you, one or two of you, or if or possible everyone, to just put one word like healthcare delivery system in India. What does the first thing which comes to your mind? Just a single word, so that at the end we will know that whether we are in the same board or whether we need to bridge the gap. Okay, so just I'll give you a minute. I want every one of you to just put a word, single word, saying that healthcare delivery, this is what comes to my mind. So in the chat, you can start on. Just a word which you think you want to learn in this, or which you think comprises of this healthcare delivery. Yes. If I'm getting no response, it means that either we know everything in this, or we are just starting with the alphabet A in this. Okay, so I've not got any response. Okay, I'll start with the class. For now, I'll just share my screen. Yes, so the screen is visible. Yeah. So the screen is visible. Can I have some interaction? Okay. Thank you. Thank you. Yeah, thank you. Okay, so it's going to be healthcare delivery systems in India. So, can someone tell me what is the difference between healthcare delivery and healthcare administration? Yes? What is the difference between healthcare delivery and healthcare administration? Any idea? Okay, so to put it in simple terms, so delivery is something which you get from where you get. So healthcare delivery is places or any systems where you get healthcare. So that healthcare need not be necessarily any kind of treatment. It can be mere counseling or just medications. So those kinds of systems where you get healthcare is called as healthcare delivery. And healthcare administration is who is taking care of this delivery, under whose supervision this delivery is being done. So that is called as health administration. So whenever we start reading, this healthcare delivery is not just delivery. It's a combination of administration plus delivery. You understand? So whenever I want to deliver something, whenever I want to give something, I need someone to tell me whether what I'm giving is correct, whether it's reaching the person or the end user correctly, and the end user does not have any problem. So the management which happens, so the coordination which happens between the customer and the production or the source is the complete aspect of a organization, management plus delivery. So whenever we say this term healthcare delivery, it means everything. Okay, so let's move into our class for now. So this is what I have planned. So for the NEET people, this at the end, you will be learning on this. What are the counts or how many centers are there? And for each center, how much it caters. So that will be the points which you need to note. And apart from that, like I said, WHO themes, because every year we have at least one or two questions in this. It's not just in NEET, but as well as in the other competitive exams like NEET. So we get this WHO themes. Well, what is the current theme? What is the theme in the past year? Or any themes related to particular disease. So that's how. So it's very, this part is very important. And the important days. Okay, so the important days over here will include not just the health day and other, there are a lot of days, but you have some set of 10, 12 days, which is being compiled and given to you in Soman Peter. So you may have to look into this. So for NEET people who are preparing NEET this year, you can look, these will be your take home points. For others who are there, maybe an undergrad who is giving up an exam, you will may have to concentrate on certain theory questions. Though this healthcare delivery system in Soban Peter has a vast topic, and there are even healthcare agencies in it, I'm not dealing with the agencies. I'm just going to deal only with the delivery system. So in that, you may have to know certain short notes or certain important questions like these Anganwadi workers, Asha workers, 3-tier systems, all these things will come. So for the others, this is one important part. And more than that, for you to understand how all these came up, you need to know something called as planning committees. Okay, so whenever a program is going to take place, the most important thing is to plan. Even for this simple live, the people or the organizers take 4-5 days prior, they talk to the faculty, they come across with a topic, they ask the students which part they want to know, and they plan it meticulously, and they do it. There is this order in which it goes on. That's why whenever you do a live or whenever you do your program, it becomes a success because it has a plan. Of course, you can say sometimes, going out with friends, that's an exemption. You plan, you flop. But you don't plan. Unplanned trips are amazing. That's different. But whenever it is a huge mass, a public program, it needs a plan. Okay, so that cannot go unplanned. So this planning is very, very important when it comes to healthcare delivery systems as well. Okay, so how all it started. Usually when you try to understand a concept, the best part of any concept is the history, because the history is going to tell you so many things, the story in which it goes, the minute details is going to give you the rationale or the reason why this committee was formed, or why such a program or such a tier system is being present. So each and everything has got a history, or it has got its own significance. So this planning committee forms the basis of why a healthcare delivery system in India came. So the first thing, so how I'm not going into depth of each committee, I'm just going to present it in such a way that how you need to understand, or whenever an answer is asked, or what are the points you need to know. So the planning commissions or the planning committees, initially this evolution of this healthcare delivery systems, it all started in 3 phases. Okay, so you have got something like phase 1, phase 2, and phase 3. So the first phase was from 80 till 83, 47 to 83. So during that phase, something came up. What is the problem? Any guesses? Anybody wants to tell me? What was the major problem in that area? No. So the major problem was malaria, or I could say communicable diseases. Okay, so the communicable diseases was increasing, and the mortality rate because of that was also increasing. So the first committee which came into force that time was the board committee, or you can also call it as the Health Survey and Development Committee. As the name suggests, the chairman or the chairperson was the committee was Joseph Bohr. So what did he do? So why did this committee come? So like I said, his observation during that time was the crude mortality rate for malaria, TB was more. It was increasing. He was not able to combat the situation. The infectious diseases had took a huge toll on the public. So the committee or the government has to do something for this. So he made a broad survey, and he came up with 2 things. The first thing was to make PHCs. What is PHC? PHC is nothing but... Why is the crowd very silent today? Why am I not getting any responses? It's quite a dry topic, but let me tell you just, one thing, that this is very important for you as a healthcare professional to understand how the government is functioning and what exactly the government is doing to the public. So for that, you need to understand this healthcare delivery system. So what is a PHC? I think everybody should have known this, right? You have got your peripheral centers, you've got your satellite clinics and urban PHCs. It's a primary healthcare center. Okay, so I think this is going to be more of a monologue class today, why I'm not getting any responses. Okay, so PHC is a primary healthcare center. So the board committee was the first one to propose the concept of PHC. He said that PHC should be present for at least 40,000 people. So for a group or for a community of 40,000, I need to have one primary healthcare center. So what does that primary healthcare center should do, or whom should it cater, or who should be present in that primary healthcare center? He said one medical officer, one head nurse, and then one healthcare worker, one male and one female. So he said 5 people. 5 people need to be present over there, and they will do the reference. So the concept of primary healthcare center was given by Bohr. Okay. So what happened? This happened in 1946. Why this came up? Because at that time, the mortality rates because of the infectious disease was high. So to combat that, I need to have certain centers. A single hospital cannot cater to a whole village. So if I am able to divide the village into some blocks or some committees of 40,000, and I'm able to give them one center for them to approach, then I think I'll be able to have a control over what is happening. So that's why this concept came. So it's a Health Survey and Development Committee. So that's why this name. So the next name or the next committee, which was formed in 1957, was Mudaliar Committee. So the chairperson, again, it's there in the name. It's Lakshmi Swami Mudaliar. So what did he do? So he strengthened the concept of Bohr. So Bohr gave us the concept of PHCs, and Bohr also gave us the concept of comprehensive health care. That is care of health from cradle to grave. So he gave this concept. So this concept needs to be strengthened. So how am I going to do? So the purpose of this Mudaliar committee was to strengthen the developments of war and to make recommendations for future plan. So he said the primary healthcare center is one huge place. It's going to cater 40,000 people. Let me introduce another concept called as sub-centers. Okay, so the Mudaliar committee gave the concepts or introduced something called a sub-center. So this sub-center is nothing but another subdivision of my primary health care. Okay, so this sub-center is going to be of two types. You have type A and type B. So what is the difference between A and B? Anybody wants to guess? It's all there in your social media. No guesses? Okay, so type A, it's going to have all medical services, but no birth delivery service. Okay, so, and type B, it's going to be inclusive of those birth delivery services. So type A is not going to have all, it's going to have all services, but no birth deliveries will happen in type A. But in type B, you will have the provisions and the facilities for birth delivery as well. So this was the difference, and the population they're going to cater is going to reduce. So my small sub-centers is going to be the building blocks for my PHCs. Okay, and this sub-center is going to cater around some 3,000 to 5,000. And my PHCs is going to cater around some, anybody wants to tell? We'll see that in the subsequent slides. I am the one who's talking on this. Why I'm not getting a response? Okay, so you have the board committee. You know why board committee was formed. We had the primary healthcare center. For why we had to need that? Because there was an upsurge of the infectious diseases. So we need to have a primary healthcare center. And this needs to be strengthened so that it could be delivered properly, which was done by the Mudaliar committee. And the next one we have is the Chada committee. Okay, so this is actually, like I said, the whole purpose of this planning committee was started because of the upsurge in malaria and TB, right? So we had to do something to bring it down. Though these committees were able to cater services, the main problem, the core problem of malaria was untouched. So the Chada committee came into force in 1963, where he talked about more on malaria. The PHCs concentrated on delivering more interventions, more treatments, more beds, and more kind of community interventions for the malarial aspect. And they wanted to eradicate malaria. It started with the National Malaria Eradication Program. This committee was the backbone of this National Malaria Eradication Program. And further on, it was later up to like in 1980s. Even now we have malaria, but the reduction came only after some 5-6 years after the Chada committee formation. So the next we have the Mukherjee. So what this Mukherjee did, he actually wanted to do something. In Chada committee, apart from the malarial eradication, another concept called as multi-purpose worker came into existence. So what does this multi-purpose worker scheme mean? As the name suggests, people who are working in the malarial eradication can as well cater the other health services. Though all these things may look simple to us, because when I go to a hospital, I have, let me say some, my core problem is palpitation. But if that is the case, I will not be just going to see a cardiologist, right? Sometimes I may have an additional checkups. Since palpitation is something which could be related to respiratory as well, you will have multiple specialists who will be looking into taking a lot of tests. So when I talk now, it may seem like, why is this so stupid? We all know when there's one problem, and when a person apart from who does not have malaria comes to the center, he needs to get treated. But that was not the way it was in 1960s. So they had to concentrate malaria. They will be concentrating on your malaria. But the committee suggested that let us not just confine ourselves. Right now, we have got super specialty hospitals and other things. That is different. But initially, when the healthcare program, the way in which the administration was set up, this is how the small things. Like I said, the small details are the one which is going to give you the rational or the explanation as why certain things are now operating in this manner. So the Chara committee gave the concept of multi-purpose worker. So he said, let us not just concentrate on malaria. People are coming with a malarial problem. People want to have some treatment for malaria. Let them also look into the other aspects, because malaria is just one small part of my public health. I need to look into the other aspects like immunization, sensors, sanitations, nutrition, family planning. So all these things I need to work. So let me introduce the concept of multi-purpose workers. So that is what Mukherjee did. So he made a staffing pattern. He said in sub-centers, this is how these many staffs need to be there. In PHCs, I need to have 12. In CHCs, I need to have 24 staffs or 21 minimum. And there must be one pharmacist, one super specialty person, one gynec, and all these things must be present in a CHC. So this is how this patterning of how many people or personnel is desired or is wanted. This kind of chart was given by Mukherjee in 1965. And then came the concept of integration of health services. So you have got something called as vertical and horizontal national programs. So as the name suggests, vertical, all the programs, the committees, the officers are in same line. They will be interacting with each other. Horizontal, you will have one below the other. Let us say, take an example of school or college. You have a management dean, and then you have a principal and HOD and reader, professor. So that's how it goes, right? The hierarchy. So that is horizontal, 1, 2, 3. So the topmost person will be like managing everybody. So the next subsequent supervisors will be managing that below person. So that's how. So this concept of vertical integration, that is, let us make all the deputy, the director, the secretary, everyone in the same way, and let them all be paid equal. So this is what the concept of Jhunjhunwala. So he said, you work for 6 hours, you will be paid for that. You work only for 5 hours, even though you're in the same cadre, you'll be paid only for 5 hours. But this concept was broken down by Kartar Singh in 1972, where he said, though I have got multi-purpose workers, you're paying people based on the way they work, everything is fine. But I'm not able to give equal importance. The utilization pattern in which you are taking care is not adequate, or it doesn't look good. Because when a person is concentrating more on malaria, because there's an upsurge of this problem, he's concentrating more on eradication, he is not able to cater equity or good amount of quality service on welfare, family welfare or family planning. So I am losing that part of my public health. So what he did, he gave another concept. That is, 2 main concepts was introduced. So first one was to eradicate infectious diseases, which was done by the first 3 committees, just nothing but Bor, Mudaliar and Chadha. And then the next 3 committees gave the integration of various health services for a particular center. So that was the Mukherjee, Jhunjhunwala and Kartar Singh. So each of them told us that how important it is to segregate this planning, or how important it is to make the staff planning, and how important it is for us to integrate these services. So this was the major or the milestone committees which is being present to us. So how this committee is actually integrated to the current healthcare system will be your question, right? So what actually, why am I talking on these is, if you can see that how it has been evolved. So the first phase had a board which talked only on the primary healthcare centers. And then came the concept of sub-centers by who gave the concept of sub-centers? Which committee? You are not able to follow me. Yes, thank you. At least I have one good soul. Thank you. Yes, it was there. So they gave the concept of sub-centers. So the next, the integration of healthcare workers, right? So that's happened by Mukherjee and Jhunjhunwala. So what they said, integration of health workers means vertical programs, different types of programs, single people working on different concepts. But that was shattered by Kartar Singh, who said that let us have subunits. Let us have different units and let them specialize in one, and let us move forward. So there came the concept of super specialization, catering different fields with super specialty. That is the basis for district hospitals or CHCs or medical colleges. So this is how this forms the basis. How sub-centers came, PHCs came, CHCs came, and district hospitals with tertiary care came. So the key points or the recommendations by each committee paved way for the triangle which all of us read. Okay. So this whole thing, this entire picture is the concept of healthcare systems in India. So like I said, what is a health system? A health system is nothing but any kind of service. You can have allopathy, homeopathy, Ayush, Unani, Siddha, everything. Everything is a health system in India. And you all know that India has got a diversified culture, diversified pattern, demography, and distribution of diseases as well. So you need to have a diversified health system as well, because here culture and beliefs still play a very, very major role. The taboos and the norms and norms or folkways, everything which you have read still plays a role. Even in this 21st century where the world is marching towards, artificial intelligence, robotic surgeries, still the cultural belief plays a very big role in Indian system. So that's why we still give equal importance for the indigenous systems as well as the allopathies. So you have got a public sector, a private sector in India. So the concept of insurance or the third party payment is still in its baby steps over here. That's why we do not have another element in this healthcare classification. So you have a public sector which has got primary care, healthcare, hospitals and centers, health insurance, and other agencies. And under that, you have got a lot of schemes like central state health employer scheme and employee state scheme, government health schemes, rural hospitals, specialty hospitals, teaching hospitals. So this, you just have to look into it by heart and write it. You don't have a choice, but it's an easy way to remember is public, you have got PHCs. You can write that. Under PHCs, you have two things: primary health centers, sub-centers. And then you can write district and government hospitals. That again, you can write specialty, teaching hospital, teaching government hospitals, rural hospitals. And then you have insurance scheme. Government has given only two schemes, ESI and CSI. Remember that. And then other agencies will be railways and defense. So this way you can remember primary, community, government, like that. And then you have a private sector, which is private hospital, general practitioners and clinics. That's very simple. This is a straight line. You don't have any subdivisions. And indigenous concept, you have Ayurveda, Unani, homeopathy. And this unregistered practitioners are nothing but quacks. That is even being present. So you need to know how far the quacks play a role in the system as well. And then you have voluntary health services and national health programs. So all these things, the entire public sector and the private sector, the indigenous systems, these two, this public and indigenous system, will be integrated into a national health. Okay, so when a program is being launched, the first people or the pilot testing will happen in the government and the rural district hospitals. Once the schemes are being established over there, they'll be taken up by the private sector with a modification and amendment in the way in which it's getting paid. So the same scheme, that is, the common scheme which is being present over here is the Chief Minister Comprehensive Health Scheme, right? So that was was integrated into government hospitals. And then later on, right now, we have it in every hospital, every center, the scheme is being implemented. So that's how it goes. So the major headings you need to know is public or the government sector, private sector, and the other indigenous systems. Why we have indigenous systems? Because India is a diversified country with a lot of cultural beliefs. And then next we have voluntary health agencies and then national health programs. So the national health programs are nothing but the small schemes. Government is huge. The huge government is going to select the important, prioritize certain populations, and it's going to give us some policies or programs. So those programs or policies is given by the national health program. Okay. So now what we have seen is the delivery care till now. So this is how it's being delivered. These are the places of the delivery centers where we get healthcare. So how these came up? So who categorized this? Who proposed that there need to be a rural hospital, district hospital, a specialty hospital, and ESI, CSI? Who proposed this and how it was done? So that gives us another concept called as a three-tier system. So this three-tier system starts with the center, state, and the district. So under each, you have got different ways in which the healthcare is managed as well as delivered. So this is one huge, very common flow chart, which shows that the cabinet of ministers, and you have a deputy health minister, and that person has two parts in it. That is two major heads to take care. One is health, another is family welfare. So these are the two major chunks you need to remember: health, family welfare. And under that, you have got secretary, joint secretary, deputy secretary, and staffs. So this joint and deputy secretary will be always present under a health secretary. So any idea who is the health minister of Tamil Nadu? No? Health secretary? Okay, maybe you can look into these things. I'll just give you a small homework so that you can look into who's the health minister of Tamil Nadu and the secretary. So this is the organization level, the administration level at the central. So you have got a union government, and it has got something in the left and the right, which they call as union list and concurrent list. So what is this list? It's very simple. Let us take one example of a home. Okay, in our house, our mom will prepare a grocery list, or which will have for everything, right? The needs of the house, her needs, your father's needs, and if your grandparents are there, their needs. So this entire list which your mom prepares for everybody's needs is the union list. Okay, so that is the center control. So the center has got control over certain things. That is, it is the ultimate power. Even the state is going to oppose, the decision is in the hands of the center. So that is called as a union list. So the majority of the things like international trading, your crime laws, and all these things will come under union list. Defense, how the defense should be there, the railways, all these things will come under union list. Then there is something called as a concurrent list. Okay, this concurrent, as the word says, concurrent. Concurrent means to be in line with something. So union list is one thing. So I need to have something else to be in line with, right? So to be, that is your state list. Okay, so same way in your mother's list, the portion which is under your control, or which is under your father's control. Your father, maybe your mother would have added, say, shaving cream for your father. Maybe your father does not want it. He has a right to change it, right? So the part which the father has, a particular person, particular state has control over, is called as a state list. So that will be like marriage policies, crime laws, all these things. So all these things will come under state list. So the concurrent list is actually a union between this state and my major union list. So the part which is common, like education, marriage, so all these things, forestry departments, all these things which is concerning both my central power and my state power will be my concurrent list. So the government has rules the entire constitution under three lists: union, state, and concurrent. Okay, so you just need to remember these words and just know that what is the power. So union, the entire power, the ultimate decision is by the central. And concurrent, it's a partly. I cannot say 50-50. The power, that separation is not being given. It's just safe concurrent list consists of the subdomains which is concerning both my central as well as my state, or which the parts which require development of the entire nation as well as the state. So education is one such arena, because more literacy, it is going to benefit my nation as well as the particular state. So that is concurrent list. And state list is entirely on the state. Okay, so these are all the different lists in different domains. There are around 100 items in union state, and 60 items in state, and 50 items in concurrent. So each item, how they are done, under what are all administration is being done, you will be seeing now. So under the central government, you can divide them into two parts. One is the health, that is the family welfare, right? So under health, you have got a council. So council is nothing but a group of people who will be actually coordinating all these services. So that is only your council. And then under health services, you have got nursing and medical hospitals, community health centers, and general administration. And under that, you have education, drugs, health programs, and national institutes, and everything. So apart from that, you have family welfare. So health will comprise of council, Directorate General. Under Directorate General, you have got medical colleges, community health, and general administration. So one was health, another was family welfare, right? So under family welfare, you have family welfare program, family planning, and then population census, counting, all these things. So this is how the central level works. Next, coming to the state. So state again has a state list and a concurrent list as well. This again you can divide it into two parts, same way, education part and services part. Under education, you have got medical college, two things. One is the research part, and under research, you have medical, dental colleges, nursing colleges. And like I said, we have, apart from allopathy, we have other types of Indian medicines, right? So those directorates will also come under education. And under services, just remember JD, DD, RD. So JD is joint director, DD is deputy, RD is regional. So all these people, what they do, they take care of the family training centers, nursing services, and public labs. So JD, DD, and RD will come under services and under health. And under education, you have research for allopathy and other than allopathy, Indian systems. And under that, you have colleges, research labs, nursings, and everything. So this is the flowchart for a state. Another last is the district level. Under district level, this forms the basis or the basic block. So 5 districts forms the basis of my building, which is being built by the state and further being taken care by the central, right? So the basis, what are the bases? So a district needs to take care of the ultimate thing or the core thing, which is nothing but the malaria. So it will have malaria unit, TB unit. So that is infectious diseases unit, non-infectious diseases, paramedical, immunization, nursing. All these things will come. Why? Because it is going to cater the lowest level. So these are going to only further being administered by the state as well as by the center. So the main job of the state and the center is to manage the district level. So the district is the one who's going to enter the field and is going to take care of us. So you are going to have a medical officer and all these blocks, a sub-center and village level workers. So this is, so it is difficult for us to remember the entire chart. So if you can remember just the chunks, it will be easy for you to write it out. Okay. So just remember the district, different subunits will be there and it will be taken care by the municipal officers, sub-centers and village health workers who will be working on field to take care of this healthcare delivery. So this now makes some sense. So whenever a healthcare delivery is said, this is the triangle which comes into force. So whatever we have spoken till now, it's just this. So like I said, initially in the history, the entire committee started with sub-centers, PHCs, sub-centers, CHCs, district hospitals, medical colleges. So why are they being divided into primary, secondary, and tertiary? So primary care is the first care, or the primary health is the first, that is this part which we are talking now is the first contact, first level of contact for any person. The next referral, the first level of referral, that is who takes us to what we need. So that is CHCs. The last one who does the interventions, who takes care of our quality of life, the tertiary levels. Okay. So this sub-center caters 3,000 to 5,000. So the 3,000 is in hilly or rural area, hilly areas or tribal areas. And for 5,000 population, you will have one sub-center, which is in both urban and rural. And primary, same way, the lower limit will be catering hilly and tribal. Why hilly and tribal? Because they are more prone to they are generally tend to have a lower socio-economic, and they will be, scale of the treatment, they will be in the lower scale. So that's why less number of people are given more attention. So 20 to 30,000 is PHCs and 80 to 120 is CHCs. For tertiary care, you don't have any specifications, but still there are certain norms which needs to follow. So you need to know those norms. You can go into tnhealth.org or nhm.org. So these two will give you the updated number of CHCs and PHCs in each state as well as districts, which you can have a look before going into your NEET exams, because sometimes you could be asked about the updated PHCs and CHCs levels. So these are all the numbers. This number of people, how many population coverage is one question which you can expect in your NEET exam. So you can just remember or note it down. So sub-centers 3,000 to 5,000. The lower limit will always target the tribal or the rural populations, and upper limit will target the urban populations. But in sub-centers, 5,000 is the same for rural and urban as well. Okay. So one additional statement which I wanted to talk about is the oral care delivery. So far, all we have seen is concentrating on general health. There are no specific sub-centers for oral health. And now, though the NHM has now taken the effort to put the dentist in a PHC, still the concept of integrating oral health care delivery is not yet come. So this is the people, the dental personnel, the auxiliaries. In India, we have a dental mechanic and a hygienist in the auxiliary segment. Other than that, we don't have anybody else. So these two people, along with the dentist, will be giving us education as well as training. So that is how this oral health is being delivered. So it is being delivered in three parts. One is education, another is preventive programs, another is the curative programs. So in education, you give more oral health education to the school children, to vulnerable population like the pregnant mothers or any high risk diseased, high-end risk disease people, diabetes, hypertension. All these people have customized cardiac patients, people who are having stents in them, people who are undertaking anti-epileptic medication. So all these people will have oral health education, how they need to take care, disabled population. So that's how it's being delivered, the health education. Next is the preventive programs. You have got the most famous school dental programs where we go for patent fissure sealants, ART. So all these things target the promotion of fluoride, which is being considered as the age-old pattern of anti-caries aging. The next we have the curative services where we have where we need to look into the private clinics, the school health programs, and the other camps which is being conducted. So the oral health delivery is happening by two people. One is the dental personnel, other is the auxiliaries. And they give this oral health delivery in three sectors: education, preventive, and curative. So just remember this as an additional point for you. Yes. And the next thing, so far we have seen how the healthcare works, how the system works, and why all these things came into force. Who was the one who proposed this, and what was the background behind that? So these two people you need to know because they are the heroes or the heroines of the entire healthcare system. The Anganwadi workers and the Asha workers form the basis, or they are the cells for this body of healthcare delivery. So a cell is a very important structure because a single piece of cell or a single living or entire organism is made up of cells. So the cell of the healthcare delivery is Anganwadi and Asha. So Anganwadi workers were the name, or these kind of people were introduced with the ICDS scheme in 1975. The Asha workers came under the National Health Mission. Okay, so both of them cater a population of 1,000, and the Anganwadi workers are paid amount of 1,500, and these people are paid amount of 400 with additional incentives. And when we talk about the qualification, Anganwadi workers, they need to have a 4-month training. Though there are no specific qualification, it is just recommended they had undergone a certain schooling and they go 4-month training. And what do they take care? They take care of the activities. I've just given a mnemonics, that is RPEN. R is referral. The main thing they do is, Anganwadi do is referrals. They refer them to CHCs, PHCs and district hospitals. And then education, preschool education is done by Anganwadi. All these Balwadi schemes, Balwadi programs, special nutrition program are being taken care by these Anganwadi workers. And then you have, immunization, nutrition and supplementary nutrition. So the same R pins come over here. But here the R stands for reproductive and maternal health in under Asha workers, and S stands for sanitation. So these are the two additional works which they do. And the P over here stands for parenting, breastfeeding, how to take care, prenatal, natal, all these things. So though these both are RPIN and RPINs, the R over here is referral under Anganwadi, and R under Asha is reproductive health. P under Anganwadi is preschool education. P over here is parenting and breastfeeding. I is immunization. Here N is nutrition. Here N is nutrition as well as neonatal care. And S is sanitation. So these are all the work they do. And Asha workers are picked up from a group of community who will help us, who are more familiar. That is, in a group, you will have someone who's very famous and whom all of us will listen to, right? So such people, mostly females with 25 to 45 years are considered, and they are being picked up. And they will be delivering all these kinds of activities. And they will be integrating with Anganwadi workers. They will be conducting meetings, and they will be referring the people to the next level. So this is how these two people work. And these two are the cell of the entire body of healthcare delivery. The For people who are going to take your exams, UG exams, these two could be a question as a short note. So you write the points under these headings. This will be useful for you to get good marks. And then we can now, so far what we have seen is the healthcare delivery system. So these are all the important things which you need to understand, which you need to know. So every time when you read it, it's a very volatile subject, because I cannot remember Directorate of Health, Directorate of Family Welfare, Directorate of Healthcare Services. It's confusing. But if I'm able to understand that is what it does and who is involved in it, I think it's easier for us to know. So the next thing for people who are taking NEET exams, you need to definitely by heart these. But remember, each theme which is being given here has a story behind. So if you just go to WHO health themes, you just type it in your Google, you will go to the WHO website. And under each theme you click, there will be one paragraph story. Why this theme is being given this year? So this 1,000 cities, 1,000 lives came into growth because there was a upsurge of urban growth. So they wanted to understand the health of urban health, so it came. So each thing, the vector-borne diseases, again, there was a resurge of malaria. Though malaria was almost eradicated, there was a resurge during that time, and there were other chikungunya, all these things came. So we had to take this up. So that's how each thing goes. So the recent months, I've written it here. So 18 and 19, both the themes concentrated on universal health coverage, everyone and everywhere. So if you can understand it better, the entire concept of the World Health Day, which WHO is celebrating, is because of the tagline, health for all. So from 2018, we started, though this was given from 1940s and all, the recent themes is going to concentrate only on the universal healthcare. So 1919 said, I need to have a universal health coverage. Everyone, everywhere. Everyone needs to get it, and everywhere it needs to be there. So I need to do what I need to do for that. I need to implement strategies. So I had to build strategies for universal healthcare in 2020. And then I understood this health is not a single man's gift. It is multifactorial. So I started to build a healthier world for everyone. So I'm not going to concentrate on the coverage. I'm going to make the environment in such a way that it is going to be healthier. So 2021 theme is building a fairer and healthier world for everyone. And this is another story for this. Why? Because 2020, 2021, we are still facing the consequences of the COVID pandemic. Unfortunately, during the COVID pandemic, the lives of the people in the lower sector who were in the lowermost region was lost. Too many was lost when compared to the upper end. So this building a fairer and a healthier world for everyone came into picture because COVID took the death. The toll of COVID was more on the lower end. So people who are disadvantaged, who do not have good access, the disabled population or the elderly population or the lower socioeconomically people who do not have access to the healthcare sector just because it is costly, lost their lives. So WHO thought that it is time to make stakeholders aware that health is not money. Health is something which needs to be given equally and with equity. So that's why this concept of building a fairer and a healthier world for everyone came into force in 2021 by WHO. And then you have the important days. Like I said, these are all few days which is being mentioned over here, but for you to remember, at least you need to know these. 7th April, World Health Day is important. And the 31st May, No Tobacco Day is important. 1st July, all of us will celebrate, so we will not forget. We'll be wishing each other. So that is there, Doctor's Day. And then you have 2nd October, Anti-Drug Addiction Day. You can remember like Gandhi Jayanti's birthday. So Gandhi was the father of our nation. Right, he was appreciated in such a way. So he will definitely require our country to be free from drugs. So that is one thing you can remember. And 13th October is the International Disaster Reduction Day. Or if sometimes the third week of the third Wednesday or Saturdays is being celebrated as International Disaster Reduction Day as well. And then you have AIDS, Anti-AIDS Day in 1st December. So these are all few things you need to remember. 7th April, 31st May, 2nd October, 13th October, and 1st December. So these are few questions which have been already asked in your previous NEET paper. So just remember them. So like I said, let us do a recap. So I wanted to teach you guys this. So I think I have given you the count of the centers, and there you need to look into WHO themes and important days is being given. And for others who need to understand this three-tier system, how it came into force and how each system evolved and who are all Anganwadi and Asha workers, what are their roles. So all these things are discussed. And we also discussed the different important landmark planning committees, when it was formed, who was the chair, and what was its purpose. So that's all for today. So you have any questions? If not, I'll go to the MCQs. Any questions? Anything you want to discuss? Anything more? Any part which you think is confusing or you want to clarify? Okay, then I'll move the questions. Yes. So what is the population coverage by subcenter in hills? Yes. I think it's a very, yeah. Yes, 3,000. Anybody else wants to answer? Okay. Yeah, it is 3,000. So the next one. So the subcenter, yeah, I think it's given the answer. So the subcenter that provides the birth delivery is type B. Okay. So the next one is the PHC concept was provided by which committee? Primary health care. Yes. More. I think only one person has listened and only one person is answering. Though my system shows that there are 48 people in this live. Yes, that's right. It's Bohr. The next one, the multi-purpose worker scheme, which is it, though it was introduced by someone, one committee has got the name of this. Which committee was that? It was there in the slide. Yes. Even that one person has stopped. So it was Kartar Singh, which is otherwise called as the multi-purpose worker scheme. Okay. So what is first referral system? All these things could be one of the MCQs in your NEET as well. CHCs is the first referral system. The first contact is pre-HCs. Okay. So anyone can identify this logo? This is a picture question. Yeah. Nobody wants to talk. There are 47 people in the live and nobody wants to even guess what this logo means. All these things could be one of your NEET questions for image based. Okay, so this is nothing but a logo of NHM, that is National Health Mission. Okay. This, who works in NHM? That is, who is the cell for NHM? Yes, someone is answered. Yes, Asha. And Anganwadi is for ICDS. So these two celebrations, day celebrations. December 1 is for, can I have some multiple answers? No? December 1, 1st December. Just now we saw. Yes. Anti-AIDS Day. Okay. Next. International Disaster Reduction Day. It's October 13th. Okay. All these things can be asked and match the following and other things for you in your NEET. Here's the last one. So what is the 2021 WHO theme? It's one of the UNICEF question as well. I mean, now tobacco was asked. I'm asking you about health theme. And I gave you a short note also why this came. Okay, it is for building a fairer and a healthier world for everyone. Okay, so that's it. I'll stop my share. So you have any doubts? You want to clarify something? If not, I think we can end this live. Okay, thank you everyone for spending your time this Sunday evening. Hope we all learned something, and thank you for giving me this opportunity. Have a great week ahead, everyone. Thank you.